Representative Hayes of Connecticut is recognized.
Thank you. Across the country, parents are struggling to access safe, high-quality, and affordable childcare, and we all know there are not enough slots to meet that demand. While I'm happy to hear that some employers are offering childcare options for their employees, the vast majority are not working to increase childcare access. Relying on the private sector alone is not a viable solution to meet the needs of our childcare challenges. As Ms. Matsui noted, these are largely voluntary benefits. I can tell you that I worked in a child care center, a beautiful center, the Stork Club. I was in the toddler room for many years, but this employer offered no discounts to employees, and my grandmother watched my children while I spent my day caring for other people's children. This model leaves out low-income families, parents working multiple jobs, and children with disabilities. As we have seen, for many people, their child care costs mirror the costs of college tuition and sometimes even more. So we need to focus on protecting and expanding the child care programs that already exist and have been proven to work. Specifically, Congress must work to protect and expand Head Start programs. I have to tell you I'm a little biased because I am a Head Start alum, but Head Start is comprehensive early childhood education that provides health, nutrition, parent involvement programs, and all of these needs to low-income families. Head Start fosters stable family relationships, enhances emotional well-being, and prepares children for transition into school. Ms. Matsui, is it realistic to expect employer-based childcare to meet the nationwide infrastructure needs of our childcare system, particularly for children from low-income backgrounds or children with disabilities?
Thank you for the question. It's important for us to make significant public investments in the child care system so that no matter where people live, no matter who they work for, they have real meaningful choices about where they can care for their children while they go to work or go to school or look for jobs.
And since we're talking about Head Start, I have to mention Project 2025, which explicitly calls for the elimination of Head Start programs. It calls for the defunding of center-based childcare and the rolling back or elimination of protections for preschoolers with disabilities. Can you talk a little bit about how eliminating the Head Start program would impact families, children, and our economy?
Absolutely. Head Start is an incredibly important, significant component of the child care system. It's had bipartisan support for many, many years, and that's because of the important educational, health, and other services that it provides broadly to communities with low incomes that otherwise might struggle to access those benefits for children. So any threat to Head Start, along with other forms of child care funding, really fundamentally threaten an already fragile and unstable system.
That's very important because we talk a lot about on this committee about people entering the workforce and workforce development and all these things, but parents cannot work if their children are not safe. So ensuring that we grow and expand these programs is how families move themselves out of poverty, is how they enter the workforce and become providers for their families. And we have talked so little about what are the alternatives. I think that many of these plans that provide drops in the bucket do not address the larger child care issue of expanding more slots to more children and more communities. And if parents can't afford this, even on a sliding scale, it doesn't work. Ms. Burke Alfonso, we have many of the centers that you represent in the state of Connecticut. As you're talking, I'm thinking, I drive by and I see them all of the time. I'm going to give you a little, some time to talk about how those centers could complement the existing maybe Head Start structures or programs that are already available.
Thank you for your question. What I would say is I think there's many ways we already work in the communities where we operate to connect with the Head Start programs and other local providers and even national providers. Because I truly believe it's not one solution. Bright Horizons isn't the only solution. Employer-sponsored isn't the only solution. Head Start everything is a piece of the broader puzzle to solve this problem for working parents. And so when I think about what we do in the communities where we live and work, we do trainings where other facilities can come together. We've had some partnerships with Head Starts where we've done some local trainings as well as national trainings. I think, for Bright Horizons, we focus on education of young children. We also focus on education of our workforce. So we provide free education for all of our workers to go get a college degree and continue to develop their careers with Bright Horizons.
Thank you. My time has expired, but I would just say that a really good model for attracting employees is to pay them well. And with that, I yield back.